Hi everyone, welcome to today's video. I'm Mary Felling, physical therapist, and today I'm going to be taking you through a really neat little technique to bring back strength and stability to the knees. Our knees take a beating through life because we have overuse and repetitive use things and poor postures that we're in. So use this technique daily that I'm about to show you, and it'll restore your strength, stability, reduce that popping and clicking and pain. Let's get started. All right, so what we're going to be doing is a strengthening technique where you're leaning against the wall. So the reason I had you get an extra pillow is because you want to put that behind you because you're going to be leaning into the wall. Now, if you've chosen a pillow, you can use this or this. You're not going to be needing both. I'll show you the technique with both. So you're going to lean against the wall and you want to bring your feet out so that the back of your heels are maybe 12 inches from the base of the wall. If you're, 5 foot to 5'10", 5'11", this is great. If you have longer legs or you're a little taller, you probably have to be further than 12 inches away from the wall. Just a few inches more though, not a terrible big deficit or change. Okay, so you take the pillow, fold it in half, it goes between your knees. Like this. If you're using the ball, put the ball between your knees, and all you want to do is squeeze it, and you're going to lower just to the point where your knees are about to shade over your toe. You always want to be able to see your toes. That tells you that you don't want to go any further. And then you're going to push back up and relax. That's the technique. We're going to do 3 sets of 10. So when you're ready, if you're still getting ready, pause the video. The rest of us, here we go. So squeeze that pillow, and it might make you bring your feet in a little bit more. Squeeze that pillow or the ball as tight as you can. Slow lower for the count of 5. Make sure you can still see your toes. When you stop seeing your toes, you can't go any further. And then 5, back up. All right. Relax at the end of that. Here we go again for number 2. Squeeze the pillow, slowly lower, 3, 4, 5, and then back up, 1, 2, 3, 4, 5. Make sure you have a pillow in back of you that has kind of a slick surface, otherwise it'll probably stick to the wall. You can also use a volleyball or basketball behind you because that'll roll up and down the wall too easily. All right, let's continue. Squeeze your knees, slow lower, 2, 3, 4, 5. I'm just barely seeing my toes, so I'm not going to go any further. I'm coming up, and I'm going slowly because I want to work that muscle. I'm squeezing really hard when I come up, and then I relax. Squeeze, slow, lower. This is where the muscle is really working. I'm coming back up. All right, there's 4. Squeeze again. Slow, lower. Come back up and take that break. Just a short 2 or 3 second break between lowering and raising. Squeeze again, slow lower. Come back up. And relax just to get the blood flow back into those muscles so that they've got some oxygen to burn. Squeeze again. We're on number 7 here. Come back up. Relax for a few seconds. Squeeze again. Let go. Soften your thighs. Squeeze again. It's a very short break. And while you're doing this, you might even feel clicking or hear clicking or popping in your knee. That's okay. It means your body's starting to move. Your legs are doing what they're supposed to do. It's pulling the kneecap back in line where it's supposed to be. All right, this is number 10 here, everyone. All right, take a short break. Take the pillow out from between your knees. I'm going to do our next set with the ball. So those of you who are using either a volleyball, basketball, can see what that's like. Give yourself maybe just 10 to 20 seconds between. So it's not a long rest. It's not like 2 or 3 minutes. You want to keep the body engaged. You want to keep the muscles working. Ball goes down just above the knees. I find that if you put it right between the knees, there's very little skin here and you can get sore there. So just put it a little bit above your knees. Just above that little bone on the inside of your knees, kneecaps. All right, here we go. Squeeze the ball, slow lower. We're doing 3 sets of 10. I'm going to relax, squeeze again. I'm going to hold that ball there. Sometimes it likes to pop out, forward or back. Relax, squeeze again. Back up. Relax, squeeze again. Relax. Here's number 5. You might start feeling it. You may have felt it already and you're thinking, I can't keep up. That's okay. Take your break. Maybe you can just do a set of 10 and a set of 5, and that's where you're starting. We all start at different levels because everybody's body is different. I am still taking those breaks at the end when I come back up. Here's number 8. And it's nice because these don't take a long time to do to get something effective for your system. It seems like a tiny little effort, but I am telling you, in 2 weeks, if you do these every day, you will notice how your knees feel better. All right, that's the end of 10. We're going to take a short break. Like I said, 10 seconds just to let the muscles recover, get some oxygenated blood back in the area to help oxygenate the muscles, because that's what they use to make a good contraction. All right, back on your spots. Get your pillow or your ball between your knees, and here we go. Squeeze, lower. I can still see my toes just a little bit, so I know not to go any further. Relaxed, squeeze, come back down. This is really good if you like to cycle. Bicycling really strengthens the outside of the quad and this IT band, and as that happens, it tends to create weakness over here, pulls the kneecaps to the side, and then suddenly you get pain in your knees every time you try to go up and down stairs, or if you've sat for a long period of time and you're trying to get up and it's really tender behind your knees. It's because you've started weakening this part of the quad. It's called the VMO. The quad muscle has 4 heads. The inside muscle is VMO, Vastus Medialis Oblique. And it is the one in our culture, that one muscle of the quad tends to be the weakest of all of them. And yet it's the most important. It helps keep the knee cap tracking where it's supposed to inside the groove of this bone, of this femur bone. All right, we're on number 8 here. Now you got a little anatomy lesson, so you know a little bit more about what's going on. Relax and down for the 10th and final of the 3 sets of 10. And relax. Okay, very good. You want to continue that daily for the next 2 weeks, every day. And for those of you who aren't able to do 3 sets of 10 right away, you'll see in this description below the way you want to increase it. Basically, it's if you can get to a set of 10, if you can do all 10 in the first set, that's great. And wherever you feel like you're weakening or your back is starting to hurt, that means you're overcompensating in other muscle groups, that's where you stop. And that would mean the next day you do your set of 10 and plus that 5 or 6. And every 2 or 3 days, add 1 more repetition on until you can do 3 sets of 10. That might take you 3 weeks or 4 weeks. If you've really been tired, fatigued, you've had problems in the past with your knees, and you're really starting from a place of almost scarcity in knee strength, that's great, but you will get there. All right, so here's this modification position. You're going to be doing it down on the floor. You can do this on your bed. It won't affect the effectiveness of this exercise. You're still going to need either your pillow to squeeze between your knees or your ball, so make sure you have that. Go ahead and get in this position. If you aren't on an area where you can get on your back, pause the video and come back and join me. Okay, for the rest of us, make sure you have a pillow to lie down on. I'm on a mat just because it's a little nicer than a hardwood floor. But if you're on a carpet, and it's a nice thick carpet, you probably don't even need a mat. Like I said, you can do this on your bed, But notice I'm in stocking feet. I don't have shoes on because remember we got to move those knees back and forth. So you need a slippery surface underneath your feet. All right, so get ready. You're going to put your ball or your pillow between your knees. Make sure your low back is flat. If you're arching your back, this exercise might strain it. So make sure your back is a little flat. For some of you, you might need to do a little pelvic tilt. Tuck your rear end under and flatten your low back while you're doing this. All right, here we go. So you're going to squeeze, slowly lower your legs until your knees are all the way straight. Come back up. Tighten your tummy when you come up so you don't strain the back, and relax. I'm going to bring my ball down a little bit more. It wants to pop up. All the way straight. Tighten the tummy, pelvic tilt as you bring your knees back up. Take that short break. Squeeze. Short break. Go back to your squeeze. This is number 4 we're in. If this is too much for you because you're fatigued already or your knees are shaking, that's it. Just do 5 and take a break. Take about a half a minute break and see if you can do another 5. For the rest of you, if you're feeling fine, continue along with me. If you feel strain in your back, check to make sure you're not like this and arched. Make sure that low back is flat down. Okay, we're in number 8. Short break at the end, squeeze, straighten, and here's number 10. You're going to take that short break really quick. It's maybe 10 seconds or so. You can move your legs around, you can straighten them out, whatever you want to do. I like to keep my bent and rolled into each other. Keeps everything relaxed here. This is an exercise, and because it moves slowly, it makes the muscle work hard as you're lowering and lifting the knees back in place. You can possibly feel an increase in your heart rate because you're working those muscles. So that's fine. That's not wrong to go, why am I feeling like I'm running or jogging? Because you're using the muscle. If you are aware that you have any kind of restriction with exercise, always make sure to check out with your caregiver if you have a doc or a physical therapist or exercise physiologist following you with exercises. Make sure this is okay. All right, so we're going on that second 10. And I'm going to push through a little bit more with my ball so it doesn't go shooting out. Break, squeeze again. That little break at the end is important. It does give the muscle a chance to do a short recovery, get oxygenated blood in there, so that you can always maximally contract that muscle. That's what we're doing right now. These are very therapeutic kinds of exercises. You know, it's a different than going to the gym, you know, knocking yourself out on that stuff, which is very good and helpful too. But when you're beginning and you're going back with a system that needs a little help so it can perform just in its natural, normal state, therapeutic exercises are the way to go to get you back to normalcy so that you can go into the gym and start strengthening past just what's normal for our system. All right, we're on number 8. Check again, back is flat. If you can't keep your back flat, you need to stop. Maybe give yourself a little longer time or just stop. And that's the number of repetitions you can do comfortably without your back being involved in your strengthening technique. That was 10, so we're taking that short little break here. And I can feel my heart beating. I'm definitely working and using the muscles, and I can feel it on the inside of my legs, and that's great. All right, and that's where you want to feel it. Last set of 10, you're squeezing It might help you to get your feet closer together so you can get a better squeeze instead of your feet out here trying to squeeze. Get your feet close, squeeze and lower. It's about the count of like 5 on the lowering. It's another count of 5 coming back up if you're going to be doing these just on your own without following me on this video. Don't ask me why I just took the ball out. Squeeze, I think I was trying to reset it for a better comfortable position. Short break, squeeze again. Short break. You've got it. You know what you're doing. And these are nice because you can be anywhere, anytime doing these. I mean, obviously not in the car, but you can be at work. You can be out with friends. You can be on vacation. Anywhere and do these. I feel that ball wanting to come out. The nice thing about the ball is it gives a lot of resistance compared to how much resistance you get with the pillow. You're still doing a good workout if you have a pillow between your knees. I like the ball because it makes you work a little harder. There's a little bit of give when you use the pillow. And it keeps the knees at a specific distance, so you're also always got the same width, the same pull and same contraction on those muscles. I could feel my back working there, so I'm going to be very aware on this last one that I've got a pelvic tilt and keeping my low back flat. All right, everybody, that's 3 sets of 10. I'm going to come back up. At home, make sure that you're always taking care of yourself. So when you're doing these and you're aware, well, I have a little back pain, I'm just going to go ahead and I only have 2 more to do. No, don't do that. That's when injury occurs. That's when those overuses and repetitive uses create strain into other parts of our body when we're trying to work one part. So you do want to take care of your back. You want to take care of your shoulders and the rest of your body while you're doing these exercises and also in any activity that you're doing. All right, thank you so much for joining me in this nice little technique for knee stabilization and strengthening. You'll find that as you do this over the next 14 days every day, that you'll feel better in your knees, less pain, less clicking and popping. And for the next few days, you may have, I just want to give you a heads up, you may have a little bit of increased clicking and popping only because your system is now starting to move back into its natural alignment. All right, thanks again for watching, and I'll see you in the next video.